Hi, my name is Damien. I have introduced myself with my pronouns and so is my client. And so after our session together, I gave a differential diagnosis of a gluteus medius tendinopathy on that left side. And so his or her chief complaint is really that shooting pain, that radiating pain down the lateral posterior side of the leg. And so we're gonna explain to them, just I'm gonna start off with some anatomy so they're able to understand the big picture, they're able to visualize where the gluteus medius is, what is it responsible for, and maybe it'll paint a clear picture of where their pain is coming from. So the gluteus medius is a muscle, is part of a three glute muscles, maximus, medius, minimus, and it originates on our hip, so our pelvis, specifically our iliac crest, in between the anterior and posterior gluteal lines. So that's around, if you picture your hip here, it kind of fans along that iliac crest all the way down, connects to these gluteal lines, and then it fans up, fans away, and it converges into a single tendon, and that tendon inserts on something called our greater trochanter, which is on our leg, on our femur. And we can do so if we just pretend we're squishing a bug, we can successfully palpate our greater trochanter. So it's where it originates. So if you're able to visualize it, and the gluteus medius is responsible for that medial rotation and abduction of the hip. So you can understand as a runner, so it is important to stabilize that hip while running. And so as we mentioned previously, chief complaint is that radiating pain. Our patient is a runner. Specifically, they run 10Ks, and they experience that pain approximately 5 kilometers in. So halfway through, they start to, feel that pain, start to complain about that pain. Also upon palpation, so palpating that tendinous junction, so along the muscle belly and on the tendon, that's where he or she feels that pain. So it's a very tender area, and that pain shoots down. Upon further investigation, I've concluded that doing a Trendelenburg test, this is where they are on one stance leg, and on that stance leg, the hip abductors, which is glute medius is part of it, is unable to control that hip. So as we see, when you do this, your hip kinks out and it's not able to restabilize and align, which is an indicator of weak glute muscles, as well as our glute medius MMT was a 4- out of 5, which is not full strength, which is also indicative of a tendinopathy in that area. As well, also furthermore, you have experienced chronic ankle pains on your right side. So upon further investigation, just to explain to you further, chronic ankle pains means you're most likely guarding that pain. So you don't want, as we're running, you don't want to put as much pressure on that right side. So you're most likely catering towards that left. So every time you take a step, think of all the steps we take during running, so that your hip is going tilting, your flexion. So there's a lot of moving parts when it comes to your hips. And as you take that step, if that glute is not able to contract and keep everything tight, that's where you're going to start to feel that stretch on that greater trochanter pulling. And if everything's not aligned and you're guarding this stance leg, all that pain is just gonna all that force up that kinetic chain, so up the ankle, the knee, and the hip, you're gonna feel that pain through the. There's gonna be a lot of load going through that hip, and so these are just some indicators of that glute tendinopathy that you're feeling. Tendinopathy is mainly a degeneration of the fibers at that tendon junction, so where it inserts onto the bone. There's just a degeneration of fibers that converge into that point, that insertion onto the bone. It kind of, that's per se some micro tears in that. So that's the pain that my patient is feeling. And so they are a runner. It's important to have some healthy hips while running, especially with tendinopathies, especially with their strength being a 4- out of 5. It could be beneficial for them to do some eccentric loading of that glute medius, so some sort of kickback, some eccentric controlling the kickback on a cable machine or some sort would be a good accessory tool while running. So when we think of running, we don't think of mainly our hips per se, our butt, but it does play a role, a vital role in stabilizing and aligning our hips so that you're getting that proper kinetic chain. So knee up, this pelvis, this glute is engaging and it's firing as I take my step, even though our steps aren't that big. As I hit, our glute is actively kicking out, extending on our kickoff. So when we're leaving the floor, it's kicking out, and then it's slightly rising and stretching when it's being flexed. So these are important little nuances to look at when we're dealing with hip tendinopathies, especially for runners. So for them, I'd suggest coming into clinic, and we'll fix their pain accordingly. So thank you for this, and hope the pain gets better.